Hi friends, today we will discuss about stroke, otherwise cerebrovascular accident. आज हम डिस्कस करेंगे स्ट्रोक के बारे में और cerebrovascular accident के बारे में. In this first one is definition. What is stroke? Stroke means death of our brain tissue due to lack of oxygen supply or blood supply to the cells. It may because of blockage, otherwise it may because of hemorrhaging. And we will discuss all the things later. In this we will discuss what is important thing in stroke. The important thing in stroke is time. If you are giving fast treatment for stroke, it will help the patient to get more recover from the stroke condition, and their brain also got minimum damage. Next we will discuss what are the signs of stroke. First is sudden numbness or weakness in the face, arm or leg, especially on one side of the body. Next thing is sudden confusion, troubling speaking, difficult understanding speech. Third point is sudden trouble seeing. Fourth point is sudden trouble walking, dizziness, loss of balance, or any lack of coordination. And last one is sudden severe headache with no known cause. Because these are the main signs of stroke. If you having feelings about like these conditions, it may be stroke. This topic is very important in stroke condition. Please remember fast. Acting fast is key for stroke. What is fast? In that, F means face. Ask the person to smile. Does one side of the face droop? Means you have to tell the patient to smile. If the patient face is drooping, means it may be stroke. Second one, arm. Ask the person to raise both arms. Does one arm drift downward? Means you have to tell the patient to hands up. If he can't hands up both the hands, it may be stroke. Third one is speech. Ask the person to repeat a smile phrase. His speech is slurred or strange. Means you have to tell the person to speech or speak something. If it is slurred or difficult to speak, means it may be stroke. Last one is time. If you see any of these signs, call hospital right away, because time is very important in stroke condition. You have to act fastly. Now we will discuss about causes of stroke. There are mainly two causes are there, and first one is a blocked artery. Blocked artery means it will disrupt the blood flow to the brain and it will cause ischemic stroke. And second one, leaking or bursting of blood vessels. That means hemorrhagic stroke. Means the bleeding will occur. It will cause damage to the brain cells or tissues. And one other cause is there, that is called temporary disruption of blood supply to the brain. It is called trans-ischemic attack, TIA. Now we will discuss about types of stroke. There are three types, mainly two types. First one is ischemic stroke, second one hemorrhagic stroke, and third one is transient ischemic attack. In this first one is ischemic stroke. The ischemic stroke is most common stroke in human being. In that, the blood flow to the brain tissue is blocked, and due to the blockage of artery in the brain, and it is due to some clots or any other conditions. This one is hemorrhagic stroke. In hemorrhagic stroke, it happens when an artery in the brain leaks blood or ruptures. The leaked blood puts too much pressure on brain cell which damage them. That means in hemorrhagic stroke, the bleeding will occur in the brain tissues and it will cause damage to the tissue and it will die. And in that, having two types. First one is intracerebral or subarachnoid hemorrhage. Intracerebral means hemorrhage artery in the brain burst, flooding the surrounding tissue with blood. Means hemorrhage occurs in the brain and it will flood surrounding tissue. And second, subarachnoid hemorrhage, bleeding in the area between brain and the tissue that covers it, because it is between the covering of brain and brain tissues. Next one is TIA, transient ischemic attack. A transient ischemic attack is sometimes called mini stroke. It is called otherwise mini stroke. In this, the blockage will occur for 5 minutes only, and after that the blockage will go on, and it is a sign or warning sign of future stroke. Next, we will discuss about risk factors. Risk factors means how we can get stroke. In that, first one is lifestyle risk factors. In that, being overweight, physical inactivity, heavy drinking, use illegal drugs. These are the lifestyle risk factors. And second one, medical risk factors. In that, first one is high blood pressure, cigarette smoking, high cholesterol, diabetes, obstructive sleep apnea, cardiovascular disease. These are the main condition or medical condition which can cause stroke. Next, we will discuss complication. What are the complications? What will happen after stroke? First one is paralysis or loss of muscle movement. Second one, difficulty talking or swallowing. Third one, memory loss or thinking difficulties. Fourth one, emotional problems, pain. And last one, changes in behavior and self-care activity. Because these are the main complications. After shock, these are the things can be happen in our body. Now we will discuss about prevention. How we can prevent stroke. In that, first one is controlling high blood pressure. You have to control hypertension. Otherwise, the hypertension will cause high blood flow to the brain. It will burst the artery and it will cause hemorrhage. That's why we have to control the blood pressure. Second one, lowering the amount of cholesterol. You have to decrease the cholesterol level of the body because it may cause blockage in the artery of brain. And others are out quitting tobacco, managing diabetes, maintaining a healthy weight, eating diet-rich fruit, exercising regularly, treating obstructive sleep apnea. These are the main preventive measures of stroke. Now we will discuss about preventive medication. After the mini stroke, how we can prevent the main stroke. For that, we can use some medications. First one is antiplatelet drugs. In this type of drug, which will help to regulate our clot, because these drugs are minimize the clotting. And second one, anticoagulant, and these also like same like antiplatelet, because in this also they will help to minimize the clot and it will help to thin the blood. In this we will discuss about treatment having two parts. One is endovascular procedure, second one is surgical treatment. Endovascular procedures we will in that is coiling, otherwise called coiling. In this we will insert a coil or guide wire to the main artery and will help to remove the aneurysm in the brain. And second one is surgical treatment. In surgical treatment we will open the we will use the some clipping and all, and it will help to remove the aneurysm and which will help to minimize the rupture of artery. Thank you for watching my video. Please share and subscribe my channel. Medical knowledge for you.